The growing outbreak of meningitis tonight, contracted through that common remedy for back pain, steroid shots in the spine. Today we learned there are now 47 cases across 7 states, at least 5 deaths, and a lot of people are wondering if they need to be frightened too. Hundreds of calls pouring into health clinics and hospitals. ABC's chief medical editor, Dr. Richard Besser, has answers.
Millions of Americans get these steroid shots for back pain every year. And today, the fear is of tainted injections.
You're scared too. You don't know what to do now.
So hospitals like this one in Tennessee are tracking down hundreds who may be at risk.
And you do have several symptoms listed on here.
The CDC has opened their emergency operations center today to deal with the outbreak. More than 17,000 vials of the injectable drug were shipped. Some contaminated with a fungus that goes into the spinal fluid, up to the brain, and causes a rare form of meningitis whose symptoms can look like a stroke.
To have a shot, 6 days later, you're fighting for your life.
Health officials track the problem to the New England Compounding Center in Massachusetts, which has closed down operations. There are more than 7,500 compounding pharmacies in the country. They make 1 to 3% of all prescription drugs. And they can be lifesavers, custom mixing their treatments for patients with special medical needs. But they operate with little federal oversight.
This sort of contamination of material from a compounding pharmacy has happened before. These compounding pharmacies are not under the rigorous, regular supervision of the Food and Drug Administration.
And now, patients in pain, worried about what to do next.
I'm not just concerned for me, I'm concerned for many.
It is such a tense time. So what do you do if you think that you need this shot now? What do you do next?
Thankfully, this was all recalled last week. So if you're in this kind of pain, go ahead and get your treatment. But if you got one of these injections since July, visit our website, see if your clinic was involved. And if it was, call your doctor to see if your drug was part of the recall so you'll know whether to watch for symptoms.